Hi, everybody, and welcome to the next edition of the Mirrus webinar series. We've been running these webinars for almost 2 years now, and every month or thereabouts, we try to bring a topic that is important to the industry. A quick hour on a Thursday, generally, trying to give you some really important information, some takeaways, some thought-provoking insight on a particular topic, and we always have a illustrious panel of providers to help us think through these issues and have a good discussion. So, a tight hour. We'll have you out in as close to an hour as we can. Today, we're talking about navigating workforce challenges in the rapidly expanding aged care sector. So first, acknowledgement of country. We acknowledge the traditional custodians of the country throughout Australia and their connections to the land, the sea, and the community. And we pay our respects to the elders past and present and extend that to respect to all Aboriginal and Torres Strait Islander people today. Thank you for that. Just a quick reminder that if you do collect CPD for your professional learning, then this is one CPD point, so make sure you claim that. A note on asking questions. So please ask questions on the chat. We have people monitoring the chat. They can answer simple questions. We love to get the discussion going. We love to find out what you think about what we're talking about. Please make sure you click on everyone, so that rather than just the panelists, so that everyone can see your questions. There's no interaction during the session, unfortunately, because we've got a very tight time frame and lots to talk about. But we do really value your feedback. And in particular, at the end of the session, we read all of your feedback about what other things you'd like to talk about. So we try to bring the most topical. Sometimes it's the elephant in the room. We talked about profitability last month. Next month, we're going to talk about how technology and data is changing the industry. We think that's really important. A lot of people making big technology decisions at the moment. So we're going to do a session on that next month. But we really want to know, what do you want to know about? What do you want to talk about? Please give us some feedback. That would be really, really valuable. Thank you. Today, as usual, we're going to talk about some survey findings. We polled you guys on the way in when you were registering. So we've got some survey findings to talk about. We're going to have a quick chat to the panel about where they are in their organisations on this topic. Then we're going to speak to our special guest, who's from Lockton, Morag Fitzsimons. And we're going to get some expert information around some workforce issues, and then back to the panel to really reflect on that and see what they're thinking about in their organisations and maybe for the whole industry going forward. And if we get a chance at the end, we'll see what's popped up in the chat and if there's any questions that we can put to the panel. So that's the usual format. Yeah, just again introducing Morag Fitzsimons. So she works at Lockton. I'm sure she'll introduce herself when it comes to her section, but we're really pleased to bring you expertise from outside of Mirrus. Obviously, Mirrus has its workforce platform, a rostering platform. We do a lot of work in care minutes. We do a lot of work with the industry around workforce, but we don't have a holistic set of services. So we do look for other people to bring expertise to this audience. And so that we can have a more rounded conversation. And today, particularly looking at the well-being of our workforce and the impact, that really hard financial and operational impact that has on our industry today. So welcome, Morag. Just quickly on the survey findings, these are the questions that we asked. So it continues to be difficult to find staff to help meet our care minutes. This is just the most obvious, basic entry-level question. Interesting that still 81% strongly agree that it continues to be difficult to find staff. I did have one provider yesterday tell me in Metro Melbourne that he had no problem at all finding staff, and he thinks that maybe the tide is turning. I hope that is true for everybody. Obviously, it doesn't work in every jurisdiction and every remote location and every state. But certainly for one provider in one state, that was his feeling. So that's potentially some good news on the horizon. I'm confident that we'll be able to meet the 215-minute care minute requirement on our roster. Now, this is a really interesting result. 41% of you responding felt that this was true. Just remember, there may be around 250 responses to this, but that probably represents over 200 providers. So that, generally we don't get too many people from one provider on the call. So it actually represents a large number of organisations, but 41%, it's not an exact science, 41% of you felt that you agree or strongly agree you will be able to meet 215, and that's great. I think that's a good example of people getting their head around the transition to these care minute requirements. But still a lot of people, 43% not sure. I think a lot of people are not sure if they can make it. Profitability is a factor. Availability is a factor, obviously, and 14% and 2% strongly disagree. Our organisation has a clear understanding of the employee journey mapped out from onboarding to exit. Now, it's really reassuring to see that nearly 70% agree or strongly agree that they do understand this. This is great. I think in my experience, it does reflect a lot of change that's happened in the last few years and people looking at this, certainly in a scarce staff environment. A lot of technology has been implemented into the space. And we see that sometimes because of the work that we do in rostering. There's a lot of employee journey work going on, and that's really reassuring. Still quite a lot of the industry not sure, but a lot of the industry is sure. And our organisation understands the current financial impact on employee health and its impact on leave cost and workers' compensation insurance. Now, again, nearly 80% of people, that's 70, 80%, 20, 80%, nearly 80% of people agree or strongly agree that they understand this. I think it's probably mostly to do with the fact that it does have a very hard financial impact, the rising cost of workers' compensation, and certainly the cost of absenteeism, or in the positive way that Morag will talk about it, presenteeism. So it's a very big impact on overtime as a driver of agency. So people are probably very clear on that from the financial point of view, but we're going to be talking about a lot of things that you might want to think about from a strategic point of view in retention and employee wellbeing, and really taking care of our very valuable and very hardworking staff. So with that, we'd like to introduce the panel that we've got today. Thank you so much to all of you, Marianne, Russell, Kim, and Peter, for joining us today. I know you've got very busy lives, and really this is the most valuable part of these sessions. Certainly, I think so. So the first question we just wanted to come to you and ask you is, what's brought you up to today? So your workforce journey, from your perspectives, what are the big things driving a workforce in your industry, in your organisations, and your journey to this point? Marianne, do you want to kick us off?
Sure, thanks, Andrew. Look, I think the challenges that Anglicare has faced in the last couple of years is probably everyone's challenges. So it's been, we faced into really high agency and overtime costs in our workforce. We had a highly casualised workforce as well. Now, probably that, like everybody, was a byproduct of COVID, of that COVID environment. But we were facing into high agency costs, high overtime, really super casualised workforce. On top of that, we had the layers of unstable and poor occupancy levels, and so we were sort of facing into that soup, the perfect storms, and that's been our goal over the last couple of years, has been to reverse that where we could. So that we understood that if we could address the workforce, address the occupancy, and address the workforce at the same time, we would be able to start to build stability in rosters. And if we could build in assurance of rosters, we could start to engage staff in a different way. So we weren't looking for a transient workforce, we were looking for a permanent workforce. And I'm really pleased that 2.5 years later, we're sort of sitting at a turnover rate of our staff of 15%. We're sitting around just over the 20% mark for our casual component of our staff. So we've really turned that around, and it's fantastic to see the impact for us has been on resident care. the quality of care. And that, of course, then perpetuates the occupancy, which then has become really healthy. So it's taken a good 2.5 years to do that, and a focus from a lot of people to get that across the line and to convince staff that being a permanent staff member is better than being a casual member. So a lot of that work went into working with our employees to help them understand the benefits of being part of an engaged workforce. I guess that's been our journey over the last 2.5 years. It's probably very similar to many other people.
Yeah, it's great. And I imagine involved quite a lot of employee consultation. So that sounds like
Yes.
a great story.
Mm.
Russell, do you want to jump in now?
Yeah, thanks, Andrew. And our story is similar to Marianne's. We have an added complexity in that we work in remote communities up in the far northwest of Western Australia, as well as a number of quite isolated regional settings. And for us, attracting staff into those locations is an ongoing challenge. And so we've tried, in addition to all the really great stuff Marianne's described, we've also invested a whole lot into employee housing, into specialised pay regimes for remote and rural communities. We've worked through a number of the migration scheme arrangements in some of those locations. And we've really started to focus on those elements of the customer journey you were talking about earlier on. So everything from the first contact through to onboarding, through to following up with people. Our big challenge that we're trying to address at the moment is we find people come to us, they join us, they're really excited, but after about 18 months, the level of excitement and engagement disappears. And what we're trying to do is actually work on that sort of 18 months to 3 year window, because that gives us the stability in the workforce that we're all chasing.
Interesting that you've analysed that, and you can see that. It's great. I know I've definitely worked with a number of organisations where the focus on culture is increased, especially larger organisations. It's true, but is increasing significantly. It's such a big driver of so many things. Thanks, Russell. Kim?
Look, I think we've been doing a 2-year journey as well. There must be something in that, Marianne. We started just we began with looking at our employee value proposition. So what is it that our staff wanted in order to increase our retention rate? So, we put in some bonuses, we pay people above the award, we did a survey, we looked at our onboarding, so how we actually get people into the organisation, what our recruitment processes were. We found it was slow and people weren't kept up to date. And then we looked at also trying to go away from the casual workforce, because that was really, really killing us. And I really, am changing my word to presenteeism. So we looked at that and we started to focus on making those people who had a focus on absenteeism, we wanted to turn them into people who were present in the workforce. So that took a whole lot of work. And then we also have just undertaken a whole big roster realignment, and that has been a huge change. And I've been trying to do it for 2 years, and it was really like, wasn't the time. And then just in the last 2 months, just said, no, this roster is unworkable. It doesn't meet the needs of the organisation, and it really affects our staff's work-life balance. I think we're still in the early stages of that to see how effective it's been, but anecdotally, there's been some people, people are saying we like it, Kim. The people who say they don't like it didn't like the other roster. So, those people are on that side of the bell curve. We have real problems because we are in a rural area, so our pool is small, but we have a good, stable workforce. I think our casual rate now is 10%, which I think is really good. We've dropped down our number of people who leave us. And we've also been able to entice people back to the organisation, which I think is good. And I think that comes along with us also doing a huge body of work to increase the community's awareness, it's a small town, the town's awareness of the good work that we do here, so that our staff actually feel proud to come to work. So we're not there yet. We still have gaps in our roster. We've undertaken to employ some staff under the PALM scheme, which comes at significant cost because they're agency type staff. We're also sponsoring some people who are in Australia who are on work, student visas. We've undertaken to sponsor those people, to work for Corindi Care Services, and we're in the process of recruiting overseas for registered nurses. So it's been a huge learning curve for everyone in the organisation, and I think we're not quite there to see all the benefits, but we still don't meet our RM care minutes. And I think in our next quarter's care minutes, we will meet it by 2 minutes. So we still have a very big reliance on overtime and making people work above their allocated hours in order to meet our roster. But it has been satisfying. And I think that at the end of it, we will have a workforce that is stable and will meet the needs of the organisation going forward. But all of those things that Andrew and Marianne said, we're certainly been affected by as well.
Yeah, thanks, Kim. Another comment that you made yesterday to us was, as you improve the culture and the presenteeism, the people who don't want to be there stand out more. And then you can address that specifically. If you don't want to be here, then that's really a choice you need to make. So thank you for that very much. Peter, down at Tassie, what's happening with you?
Yeah, thanks so much, Andrew. Look, I'm going to concur with everything that the other panelists have said. I think I'm just adding to, rather than repeating, some of the impacts that we've seen at OneCare, and we are just Tasmanian operated only, so not in any other state or territory. But when the visa requirements changed for regional visas, that had a significant impact across our whole state, where a lot of visa holders then just went to Melbourne or Sydney because there wasn't that requirement under the regulations to work in that regional location. So that was an interesting, almost overnight impact, unintended by government, of course, but it just was a reality. What I've seen across my organisation, though, is over the last couple of years, as we still have gaps in our base rosters, we do have difficulty attracting to the regional parts of Tasmania. And we rely heavily on overtime, but we're starting to see more work cover claims, soft tissue injuries from staff who are tired and exhausted. They're fatigued, and I think that's a reality for us. So trying to look at strategies to obviously look at staff well-being, physical and mental health well-being. I think the other thing for us here in Tas, which has been really positive, has been a greater collaboration with other aged care providers, because we often share the same resource. We have people who work part-time at one organisation, will also work part-time somewhere else. And so recognising that is a reality for many of the employees. And so going back to Marianne's point of trying to move from a casual workforce or part-time into a more permanent basis, we have struggled a wee bit in that, because there is this recognition that people will hold multiple roles across different services, and we have such a thin pool of staff that we're all vying for. At a CEO level, I think it's been lovely to have those conversations about how do we support each other, improve the availability of staff, and recognising some of the patterns that are occurring as to why sick leave is there because they're working somewhere else, for example. And I think the other thing I'd like to mention is at OneCare, we did a lot of work through co-design of reshaping our entire service model, given the workforce pressures, and how we could do that effectively with staff and also with consumers. But in essence, what we're trying to do is create a greater fluidity between residential care, home care, and independent living, so the staff members can actually work more fluidly between those components rather than being rigidly linked into RACs or home care. And so we've had some success in that. which is improving the staff engagement, which we also monitor fairly regularly, about doing something different and being able to you just have a greater variety of work processes. So, but everything else everyone said, we're in the same boat.
Yeah, and something we talked about, thanks, Peter, something we talked about yesterday as well, that hasn't come up yet, though, was drawing resources from overseas, is really a great way to try and solve some of the gaps we have in Australia, but we're potentially pulling resources from overseas locations who also have a crisis of resources. So we're not really solving the global problem. We're kind of just solving our problem. So some of those solutions are temporary at best, I think. Yeah. Thanks, guys. Thanks so much. Really, that just sets the scene. I think a lot of what you talked about there are just, everyone listening can relate to. Let's hear from. Let's meet Morag. Welcome, Morag. Thanks so much for joining us. We obviously have a great relationship with Lopton and Lopton are insurance brokers, but this great advisory capability they also have, which is really trying to solve the source of the problem. So the cost of different insurances that might relate to employee issues. Let's get upstream and try and solve some of those problems upstream to therefore reduce the cost impact of some of these things. So a great capability. Thanks so much for joining us. Over to you.
Thank you very much, Andrew. It's a pleasure to be here today. As Andrew has said, I'm Morag Fitzsimons. I'm head of Lopton's People Advisory business. And some of you may be aware, Lopton has a really strong focus and dedication to the healthcare, community services and aged care sector, because we feel it's just a sector that does such great work. So we're really happy to be here and partnering with Mirus in this partnership today. I'm going to talk a little bit about shifting focus today and thinking about retention through not only just benefits and salaries, but some of the other ways we can work with staff. Because I think, as we've all said, we know we have a shortage of staff. We're struggling to get staff now, as our population continues to age and the need continues to grow. That's not going to go away. That's only going to continue. So we really want to talk about how we get upstream and how we actually then focus on what are the things that employees need from not only the salary roster perspective, but from a health and wellbeing perspective, and how do you analyze that data in a holistic way and then work out where you're going to be. There's a great quote from Desmond Tutu, which I think Andrew's now going to share with us, which is, at some point we need to stop wondering why people keep falling at the river. And at some point, we've got to get upstream and work out why they're falling in. So when we think about turnover and retention, we've got to think about it in a holistic sense of where we're at. So I'm going to share with you today some live examples of some work that's being done and the different ways that the organisations are looking at this, to give you maybe some food for thought. And then, we'll be interested to hear the panel's view. And there's a lot of really good work that's already being done. So the poll results was really pleasing. Most people do know the cost of workers' compensation, employee absence, etc., because they are big numbers. But what we're challenging organisations is to look at that as a whole body of work, not just numbers in isolation as part of the budget. And when you understand that, you can then really understand where your target and your focus needs to be, and then what the business case is to invest in those areas. Because you are a sector that is really, struggling with funding and where you apply funding, and for every dollar of funding or money that you have, you've got 200 different ways to spend it, right? So how are you going to invest that funding and where is it? So I want to talk about an example here where, we've looked at various elements of cost within an organisation. Sick and carers leave is obviously the obvious one that we all look at. What are the sick leave entitlements? How are employees taking that? Workers' compensation is a big one, and there's a lot of organisational focus, both from a safety preventative perspective and the cost of ill health and injury, work-related ill health and injury, which is really appropriate. What we often see in these studies, that cost, when you bring all of it together, sits somewhere between 15 to 6% of what an organisation actually spends in total cost of absence. But that's where all the energy is. That's where the response is. That's where the support areas are. That's where the recovery mechanisms are. But this larger piece of work, there's not necessarily a plan around it. Then when we look at things like turnover rates, as Marianne said, 14, 15% is excellent. But if you break that down into age band and the tenure of employees, often we see we'll have long-serving employees, which will smooth that curve out. But for this particular organisation, when we looked at it, what we found was that their turnover rate for people in the first year of joining the organisation was 25%. And then in the second year, there was a further 24%. So they were in constant recruitment mode because they were bringing people into the organisation, but they weren't necessarily keeping them. And some of that was because people were moving to get better paying jobs. There was competition around, salaries. There were things that suited their lifestyle from a rostered perspective, but they really didn't understand what that early turnover piece was. And it had been masked a bit by that common view of, well, it's 14%, isn't that great? And it is. But how do we not only bring people into the organisation, but how do we keep them there? So how do we focus on that? Leave without pay is an interesting one because what people will say to me, well, why do you put a cost against leave without pay? Because we're not paying anything. But the reality about leave without pay is the flow through of that is seen elsewhere. It might be seen in an increased injury rate if people are taking on the extra load, the extra body stresses and the load to cover someone's shift if someone doesn't turn up. You'll see it in your cost of casuals, you'll see it in overtime. So when we quantify that leave without pay, either as a dollar amount and or hours, what we often see is that organisations may have tens or even hundreds of people in an FT equivalent that they're paying never to come to work in a year. But those roles are being held as substantive roles. You can't replace people in those roles. So we've really got to understand the connection of leave without pay. Why is it happening? Is it people who are using all of their entitlements and have to take leave without pay for any absences? Is it people who maybe feel, well, if I'm working an overtime a weekend and I'm getting overtime, I can take a day off of leave without pay, not impact my entitlements and still get the same money? What are the sorts of things that's driving that? So it's a really important statistic to look at. And then lastly, the concept of presenteeism. Again, a difficult one to quantify. What the Australian research tells us, that as an average for every 1 day of sick leave, you have about 3 days of presenteeism, which means someone could be at work. They might not be feeling the best. There used to be pre-COVID, it was the old, take a pill and soldier on philosophy. COVID kind of stopped that a bit, but people might have back pain, knee pain, shoulder pain, but they're working through that, either because they can't take the time off or they're turning up to do the shift. They could be disengaged with the organisation in some way. We know statistically about 10% of your employees hate you and everything you stand for, but have no intention of leaving. So they might not be particularly enjoying their job or where they're working, but they're coming there anyway. They might have had a fight with their partner. They might have family issues. So they're physically there, but perhaps they're not focused on the work they're doing. That might lead to higher error rates. It could lead to higher injury rates. Interestingly, we are one of the lowest rates of presenteeism as a ratio to sick leave because we have such a strong safety net around sick leave, entitlements, etc., Medicare. In the UK and the US, it's actually about a 1 to 5 day ratio, which is not necessarily better because you have people in the workforce who aren't actually focused on the work that they're doing. So when you look at it in that whole sense, and to give you a range of some of these that we've done in this sector, and size, of the organisation will drive this. But we've had, a total cost of absence over a 12-month period ranging from 20 million to 77 million, dependent on the size of the business and the sorts of things that are going in. And it's all of these factors that's driving it. So all of a sudden, when you understand that as an executive and you're looking at that and you relate it to a percentage of profit as this organisation did or a percentage of funding, it really then actually drives the conversation around, well, what of these areas do we want to do? So where do we want to focus our energies, or what do we want to shift the dial by? So if we want to drive a 5% or a 10% change, for this organisation, if we were to shift everything by an average of 10%, it would be about 7.5 million return back to the business in real funding over a 4 to 5 year period. So all of a sudden you have the business case for investment in health and well-being and other things to do with absence management in your business. And that can often be a challenge for organizations like yourself when you're managing that. So that's one way to start the conversation, or really work out where you're going to focus and go from there. Then if we think about benchmarking, I often get asked about benchmarking within an organisation. And you'll see on the next slide what we've got is a bit of a comparison there around performance in the areas. So we often think about benchmarking as an industry. So, you know, how do we perform from a workers' comp perspective? If we look at our premium rate versus, you know, what we're paying in premium in industry, there'll be other measures that you'll use as industry levels, but we seldom look at benchmarking internally and saying, are the unintended consequences of some of the practices and processes that we have, which might be driving turnover, which might be driving disengagement or dissatisfaction? Is the employee experience consistent in all of our locations? If you have multiple locations, often the experience can change dependent on the environment, dependent on the team, dependent on things that are going on. And your employees are not necessarily, if they have another organisation, either in your industry or elsewhere, trying to encourage them to move, employees aren't going to ask about their engagement survey. They're not necessarily going to ask about some of the things that you may measure from, they're not going to ask about the workers' comp premium benchmark. They're not going to ask about some of these things that we look at. They won't necessarily be thinking about that. What they will be thinking about is their experience in your organisation as it is now, and what the experience is being sold to them by someone else in the sector, or in a different sector if someone's trying to encourage them to leave the sector and move into another type of employment. So often when we look, and it's not about getting 100% in everything, it might be that 50, 60% for your type of business is great. But if you're looking at somewhere around about the 20s and the 30s, there's maybe something that you're not doing that maybe others are doing in your sector that would improve that engagement, increase that retention, and improve that employee experience. And benchmarking in this way will also tell you where to spend some of that funding that you may get to improve it. So if your safety management and your workers' comp management is being managed incredibly well, fantastic. Maybe focus on mental health, psychosocial risk, physical health, early intervention strategies, or how you respond to people with non-work related illness or injury. And as those sorts of things start to level out, the employee experience improves, and then you can benchmark across different parts of your business or different shift patterns or different things there to really give you that additional benchmark beyond where you're doing the industry. Because if we only benchmark at an industry level, it's very easy to fall into, oh, well, we're doing better than everyone else, so there's nothing to see here. We just keep moving as we go. Won't necessarily be the thing that will hold your employees from that perspective. I think the other challenge that we face in this sector particularly, and Australia as a country in general, is we have an aging cohort of employees that, you know, the people who are of working age are getting older. We're not necessarily seeing younger people come into this, you know, area of their life stage unless they're coming into this sector who might be younger, they may be older, they may have career in other areas of healthcare and come into aged care sector. So it's really important to understand where people are in their life sector. And I want to talk a little bit about, you know, the sandwich generation of people that we employ in this sector. And the reality is for many of us, and if we could just move forward, Andrew, the reality for many of us here is that we're not only dealing with our own issues of aging and our own issues of our career and where we're going. And you know, for some of us in the sector, we do have issues with our own health that some of the people we care for have had to address at some point, and we're moving towards that ourselves. So we're employing people who are worried about the impact of aging on our own health and where our career. We may also be dealing with the care needs of parents who are aging, or you know, other people, loved ones that we care for in the community and their own healthcare challenges. We may be caring for grandchildren. We may be caring for children of our own. We have, you know, some of us had our children later. They might be at school or university. Or that wonderful phrase, which was coined by the demographer Bernard Salt, kippers. I have a kipper at home. Kids in parents' pockets eroding retirement savings. So this, you know, generation of younger people who are staying at home longer, but are relying on their parents to either help them, you know, fund their lifestyle, help them get into housing, not even necessarily buying a home, but just being able to afford to rent, might be helping them pay off HECS debt, supporting them in the house. So the people in our workforce, we're not a homogenous mass that all move along at the same time with the same issues. You will have people in your workforce who are dealing with all of these issues, and that adds to presenteeism as well. So I want to think a little bit more about life stage planning when we're thinking about health and well-being and planning. And so if we move forward, we'll look and see that there are really a consideration around two main stages of life. Around, if you're under 45, is considered the establishment phase. You know, we're finishing our education, we might do a bit of travel with focusing on fitness, we might be trying to think about buying a home, starting our families, etc. We're gaining experience, we might be moving around from organisation to organisation. And that's known as the establishment phase of life. When we get older, we then get into consolidation. So we're thinking more about reducing debt. We're thinking about trying to work towards what our retirement would look like. We might be trying to pay off a home. Travel becomes less about less about glamping and adventure, and maybe something a little bit more sedate. As I said before, we're changing for issues. The challenge we have as we bring more people into this country from overseas, they may be in their 40s and 50s and actually not have done anything in that establishment phase at all. So, they're really faced with really trying to ramp up that establishment phase more quickly before they can even reach consolidation, if indeed they ever do, because they don't have superannuation, they don't have some of these things that we think about from a late career perspective or later in life perspective. So how do we do that? And for many people, it's about moving from place to get experience, get a better role, earn more money, maybe come in and out of the sector with a bit more experience, do different things. So when we think about retention and well-being, and great things are already being done. Russell talked about assistance with housing. That's fantastic. What are the other things that we can think about? And it might be employee benefits or insurances that help them, but it might be other things. It might be around financial planning. It might be around all sorts of different ways that we think about how we help people, move in that career and what they actually do. So, we've really got to think about our employees in that more holistic sense, which adds an extra layer of challenge beyond what you ever have when you're thinking about rostering and how you meet the care needs of the people that you have. But these are the challenges. Again, if we move forward, we'll see, we often having the conversation, we make a lot of assumptions sometimes about people and what they need, because again, we think of our workforces as a homogenous mass. Having the conversation, asking people what they need, asking people what their challenges are, asking them, what do they enjoy about what they do, or what would they like to see improvements from? And the closer you get to the front, the front line, the more you'll hear. So we've gone through an organisation at the moment where we've gone out, and yes, they do engagement surveys, and engagement surveys are fantastic. But they don't necessarily ask questions about health and well-being or psychosocial risk or burnout or some of the things that people are facing. And sometimes people will not respond to surveys, and it might be because English is not their first language, they don't feel confident responding, they're fearful of responding. So often having an engaged discussion with people will actually give you a lot of information. And again, having done this, often we find it's not necessarily about benefits or better wages. It might be about better communication, a better understanding of what's happening in your business. It might be a leadership capability uplift. It might be interpersonal relationships within the workforce and how people engage with each other that's challenging. And all of these are psychosocial hazards, and we've got to have plans to address them, but they are often the things that remain hidden because we've never asked the question, or we've never gone beyond when people are at a crisis and something is reported and then we have an issue to deal with. So I think, for me, it's really about having that conversation, and sometimes it's confronting to hear what people genuinely think and feel and the experience they're having. But it's a valuable way to then do, and then develop perhaps a health impact survey. So you understand what the impact of these psychosocial risks are. Are people coming to work fatigued because they're stressed and they're not sleeping? Are they fearful because they're having this ongoing argument with somebody in the area, in the shift that you're not aware of? What are the things that are going on? And then finally, I want to ask you to think about pathways. So often people will leave, particularly older people, because they don't understand the alternatives. They think that I can only do this thing, I'm here, and this is all I can do and all I'll ever do. And we assume that people understand what the next phase could look like or the next stage could look like. And that's not always the case. So, you know, if you're thinking about, you know, hanging on to people, there'll be people in your business that you want to hang on to because they'll have the right personality set, they'll have the right skill set. But do they understand that? And do they understand what the options are? So, you know, what are the career opportunities? You know, I'm 58. I love what I do. I could see myself doing it till I'm 70. But do the skills I have now, are they going to be adequate for the skills I'll need to continue to work in the role I'm in? Excuse me. Will technology change? Will formal qualification requirements increase? Do I need mentorship? Are there people that I should be working with in the business now who can help me? And what's my career development plan? Or, excuse me. And then what are the transition options available? Can I transition to retirement? Excuse me, I'm just going to take a quick.
Okay.
Sorry, excuse me, just got a coughing fit now. Is transition to retirement an option? Can I reduce my days to then be able to stay at work longer? I do apologise for this. I don't know what just happened there. Can I use the skills I gained to educate others in the business? Can I support? Can I be a mentor? Can I transition the skills that I have to others that you're developing in your business? Or do I need to stay fitter for work? You know, if I know that I have to keep working, how do I continue to do that? Is there a fitness program? Is there a stretching program? Is there something that I can do to reduce that risk of injury? Or do you need to think about permanent modifications to retain your staff? Thankfully, that's the end of my presentation because my voice has gotten very croaky, so I do apologise.
Thanks,
But
Morag.
thank you for allowing me to talk about that today.
That's fine. Thank you so much. So many interesting things there. Really interesting. Just that last point about fitness. Obviously, in the environments we're working in, there's a lot of clinicians and there's a lot of physio and there's a lot of allied health. And I'm not aware of. Maybe the panel can talk more about, you know, how much of an opportunity the staff have to leverage some of that expertise that's available to run employee wellbeing health programs, not just resident wellbeing health programs. It's an interesting idea. I've not come across it, but I'd be interested to find out if others have. Thank you so much. Lots of food for thought. You can't cover everything. It's a massive topic. Obviously, workforce is a massive topic, but a really interesting perspective there. Thank you so much for that information, and hope you're recovering there. Let's go back to the panel and let's finish off with some conversations with the panel. Let's look forward. So what are you guys thinking about? What you're going to do about workforce challenges and some of that information that Morag's presented there around, you know, the employee wellbeing and really taking care of your employees and with everything that they're faced with and how important they are. They're obviously, you know, such a large part of our organisation and certainly the largest part of our cost. So, and that goes exactly the same for Miris as well. So very, very important that we take care of our staff. Peter, let's go backwards and talk to you first.
Thanks, Andrew. Thanks, Morag. That was brilliant. Yeah, I think many people resonated. I was watching some of the comments fly through. But just on wellness, yeah, I totally agree. OneCare as an aged care provider recently have done a pilot program with the University of Tasmania on implementing what was called mindfulness in motion. Now, it is a US program really aimed at supporting staff at work to take an hour out of their day to go through a wellness mindfulness program where meditation, reflective practice, and all of those things come into play. The whole intent of the program was to reduce the burnout and the burden and to find out whether staff through a program do actually benefit. Now, the study itself did demonstrate some positive outcomes. We will look at expanding that program because myself, along with the board, recognise the value of staff. I think everyone online does. And so that is just, one example. I think there are many out there, Andrew, where if you're innovative as a leader, you're not waiting for a government to tell you that it's time to do something different, but you're taking the initiatives and really looking outward within your communities, even on an international or national level. There is opportunities for you to make positive changes and just try something different. And that's been a lovely thing for us to do. I just wanted to comment on the Morag's analogy about looking up the river. And, I think that's one of the things when we are focusing on trying to attract people, registered nurses, for example, into aged care. But we know that the feeder part is a little bit slow. And those who do go through university, not everyone finishes who starts. But when we start to think about well, what's the cause of that? I think there has to be a recognition that it is expensive to study at university. And if you are an international student, it's almost prohibitive. We have a lot of international people that work in our organisations that would love to do the registered nurse training, but over $100,000, it becomes impossible. I am a registered nurse. I started in 1990. And at the time, University in Queensland actually had a 4-year HECS free period because it was a transition from hospital to university. So, look, governments can potentially look at ways to reduce cost to enable people who have the right attitude and aptitude for caring might be able to study without too much cost burden. So, but look, I couldn't agree more. We have to focus on our people, and I think there are some amazing initiatives happening out there. Thanks, Andrew.
Thanks, Peter. And yeah, the just placement alone, we've been exposed to, the difficulty and the quantity and the cost of doing that in those programs are not really subsidised or paid. Thanks, Peter. Great thoughts. Kim, are you next? Kim, are you there? You talking on mute?
Thanks. I was talking on mute. Thank you, Andrew. Look, I think the management, we've got a pretty flat management structure here, which helps. But I think what we'll focus on doing is looking at how we engage with our staff. So, I think I agree with Morag. You can send out a survey, but is that really engagement? So we have been doing a lot of engagement with the community to try and raise the profile and to let people know that, this residential aged care facility is a good place to live in. So now we're going to just turn that body of work around to use that same model to engage with our staff to say, look, this is a really good place to work, and this is how we're contributing to that. And this is what, we would like you to do, or what do you want us to do to contribute to that? And also use that as a way to keep staff informed, because I think, one of the reasons for people not to have a good engagement with the organisation and to be aware of what the organisation's goals are is because we haven't told them. So a lack of information and a lack of consultation, and just constantly keeping people, our staff, our team, up to date with where we're going. And, I always say I'm just driving the bus. It's about me making sure that everybody knows where this bus is going to, and that they can see the path and the journey that we're on, where the speed humps are, what we're going to do to overcome those speed humps, where we might need to go around a few bends. I think the roster change is really, really important because it does go to people's work-life balance. We were expecting people to work awfully long hours. That, there's from time, I'm a registered nurse as well, and there's times to time I have to do, not have to, I engage in shifts, where we can't fill people, backfill or find staff to be the registered nurse. And I did a couple of night duties over Christmas, and, 12 hours. I thought, I'm too old for this. Like, nobody has to work this long. So a little bit of the roster change was self-preservation, because I thought if I have to do 2 more of those long hours, I'm going to, I can't do it. And then we're starting to look at people's roles and scope of practice and how we can. We've successfully, taken one registered nurse from personal care worker to EN to RN. So how do we do that for other staff? You know, how do we engage with the community? We've got some children who come from do work experience, school-based trainee, interpersonal care workers. How do we let them see that this is where they could work for the rest of their lives and have a career progression? So I agree with Morag. You know, our way now is to look internally and what is it that we can do to keep those people who want to work here, and to try and bring those people who are half on the bus, half off the bus, onto the bus, or you can go and find another bus, because we have to look at the needs of the organisation and the needs of the workforce, and sometimes they're disparate, you know. We have lots of people who have flexible work arrangements, and sometimes those work arrangements we just can't do it, you know. And Peter, I get I understand it's a real difficult thing, you know, and I struggle with it, you know, the needs of the organisation versus the needs of the employee, and sometimes there is a gap. So that's where we're at the moment. But I think I agree with Morag, it is how do we internalise everything and look at keeping what we've got, growing from the outside, but also letting people see that this is a place where you can stay, earn a good amount of money now, be appreciated and make a difference in your own life as well as the residents and the community.
Yeah, some really good points there, Kim. And I know that you've been focusing on the transition of staff from care workers to enrolled nurses to registered nurses. So that's a big part of how you retain staff. So that's a great thing. One of the things that Morag was talking about was that interplay between all of those statistics, you know, like that unpaid leave, or that leave without pay, and how that might be being driven by overtime, which now therefore financially they're okay. So then they take different kind of leave, and then you know the impact and knock-on effect of that kind of thing. It's really interesting, quite complex. Thanks so much for those thoughts, Russell.
And Morag, thanks for the presentation. I love that piece where you talked about the 2 stages of people's careers. I kind of hoped I was in the establishing stage. I kind of realise I'm in the delusional stage. But the sense of that for people who are coming to our workforce from a migrant path or from another career sector is really important. And I'll give you an example. I quite often get the opportunity to go and speak at our orientation sessions. And one of the things I love to do is get there early and listen to people introduce themselves. And about 12 months ago, I was in one session and we had a whole lot of people who are working with us as part of a student sort of exchange type program. And when we started to talk to them what their backgrounds were, we had someone that was a cyber security expert, someone who had come from another background, and they were starting to do caring work and those sorts of jobs. And when we looked at that, we went, hang on, whilst these guys are entering our organisation, they're also trying to establish themselves in their careers. And one of the things we can do to help them is to map out what some of the pathways might be. And we started to think about how you do that. And we've sort of trying to grab a pictorial representation of what the different career pathways might be within our organisation. And one of the assumptions we had to challenge ourselves was the pathways through the caring streams may not be as linear as they once have been. It may well be that someone works as a care worker, but then jumps into our IT department and does something in our IT department. And so we're working through how we represent that for people, so that there's an understanding that their time with us is something that they can use to establish their career as much as anything else. And we've also had cases of young people joining our workforce who come in as care worker roles, and then their eyes open up into EN and RN roles, as Kim and others were talking about. So I think part of the secret for us around engaging a workforce is also to paint for people the possibilities of how their career might develop within our organisation. And it's not just painting, it's actually being real and providing those opportunities as they come up so people can actually see that it's tangible.
Yeah, really interesting. Thanks, Russell. Marianne?
Morag, thank you. I've written copious notes for myself. So I particularly liked, and I guess I'm sort of pulling together a little bit of what I've heard today as well. What I'm hearing for us all is consider the people within our workforce. Certainly we talk about workforce. But stopping to, I think what we've done today is we've stopped to consider the people in the workforce, and I think that's really important. It's critical. And asking them what, as an organisation, what do we do well? What could we improve, and what would you like to do more of? I think it's that engagement piece that, it is communication. Absolutely right. We can't communicate enough with our staff. So how do we do that but make it meaningful, so it's a two-way communication piece. It's not just the organisation pushing information out. That's just information. But how do we actually have a conversation with our workforce? I also think the benchmarks, I scribbled them down, thinking about internal benchmarking. And Anglicare has 23 facilities. We do a lot of benchmarking between our sites, but not to that degree of internal benchmarking of quite specific workforce criteria. So I'm really keen. I'm going to go back and unfortunately then say to the team, right, here's a list. I've got a list of things we need to look at. I also think the other thing I took away is so from an employee wellbeing perspective, we've got access, most of us have got access to dietitians, or a dietitian that we refer to. We're very lucky in that we have physios at each one of our homes that we employ ourselves, our own internal physio team. And there's absolutely a space there that I thought, wow, we've got dietitians, we've got physios. We want to develop an employee wellbeing program because we want them to enjoy coming and working within a community and feel part of that community. And how do we do that? So again, there's another takeaway I've got is I'm going to go back and say, okay, physios, there's a whole bunch of you out there. How do we now engage with our staff? It's not about doing exercise programs, or it might be consultation. I don't know. I'll leave it up to the experts, but tapping into resources that we have in our homes now, in our organisations today. It's not about finding more, buying in more resources. What I've heard is think differently, think outside of the box. And anyway, that's my takeaway from today. So, Andrew, whilst I've been a panelist, I have absolutely learned and taken down a notebook full of ideas. It's been brilliant. Thank you.
Thank you, Marianne. Yeah, I tend to watch these back again, at least in part, not my bit. But I often, I'm fascinated, and I tend to think that it's a really interesting webinar if I, as the host, and I know what we're going to be talking about, and just fascinated by what you say and the content. Morag, any last thoughts that you wanted to add to all of that?
No, look, I think it's been really gratifying to hear the feedback from the panel, and I think, to Marianne's point, particularly in your industry, you have so much available to help your people and think about them from that perspective of individual care, establishment, and their needs. And if any sector can get it right, it's going to be this one. I have no doubt about it. So thank you for the opportunity.
Thanks, Morag. And just a reminder that our next webinar is about how technology and data is changing the industry. So important, because technology is such a big cost, such a big pain in the neck to change, and it really is changing quite quickly. We've got some experts coming in to talk to us about our technology strategy, and we're doing a lot of work in AI and the future of that and data as well. So really interesting. It's not just for the techies, it's really a strategic conversation. So please join us for that. Here is Morag's contact details. Please reach out to her if you want to know more about some of this content, or to us. We do a lot of work in this space as well. Happy to work. We work together, so no conflict there. Yeah, if there's anything interesting that you've heard, you will get a follow-up email as well with some extra information. So thank you so much, as always, for joining us. That's our tight hour that we've had. Thank you so much for the panelists. Thank you for giving up your time. Really, really valuable insights from your organisation's perspective. And, you know, we've got West Australia, we've got small town and down in Tassie, and you know, we've got a really and a big provider in New South Wales, and a really good cross section of the industry. So really, really valuable. Thanks everybody for joining us, and have a great rest of the day.
Thank you.